there's a few shades of light green there. And as we work our way down towards those that necessarily haven't been vaccinated, or perhaps only had one dose of COVID vaccination, that's really where we're seeing a lot of our cases at this moment in time. So you can particularly see the darker shades of blue between the ages of 20 to 24 and 15 to 19. And that's very much reflected in a lot of the work the public health team and the public protection partnership team and education team are doing, is working very much with our schools and young people, where we are seeing the vast majority of our cases. That's not to say we're not seeing any of the older age groups. I think that's inevitable as cases increase, but clearly we are seeing it in those younger age groups at this moment in time. Next slide, please. Just with regards to our ward, so we continue to keep an eye on our ward activity. This is slightly two different date sets I've got here. This one's from the 28th of May to the 10th of June, so a little while ago now. We didn't probably have as many cases across all our wards. There were a few outliers, and we are notably seeing higher numbers of cases towards the east of the district, particularly around the Reading border, so Tilehurst, Birch Copse, Burfield and Mortimer. So we are seeing activity around there. But if we go to the next slide, please, Gordon. We can actually see that is actually spread throughout the district, and there are some pockets. And you can see to the east of that district, you can see we have a darker shade of green there, where we have seen a few more cases. This isn't actually by ward, and this is a different timescale. This is to the 19th of June, but just gives you a sense of where we are seeing the activity. And most of our outbreaks, particularly in schools, are around the fringes of Reading as well. But I suspect that over time we'll see that transition across the whole of the district as time goes by. Next slide, please, Gordon. Thanks. So in terms of the variants, I know the public are very interested in terms of where we are with the number of variants. Obviously, the variant of interest at this moment in time continues to be the Delta variant, otherwise known as the Indian variants. And really all this graph shows is it's the light blue is the ones we've highlighted, and the variants of interest that we're concerned with is the Delta variant. So at this moment in time, there's been 50 confirmed Delta variants in West Berkshire. If we include those where we think there might be that haven't been confirmed, there's probably another 24, 25 or so. So anything in the region of 75 potential Delta variants that we've diagnosed. We think that number will be a lot higher, just because of the time it takes to sequence, and we know now that the Delta variant is likely to be the dominant variant across the country. So just a caution around that numbers. And in terms of Reading and Woking, just to put it into perspective, there's been 239 in Reading and 229 in Woking. So clearly we've not had as high a number of those areas, and they're the ones that have been undertaken in surge testing. As I said, it's likely that cases will increase around the Delta variant over the coming weeks. Next slide, please, Gordon. So in terms of hospital activity, and obviously the key metric in terms of the government's criteria to whether we move to step 4 is the hospital admissions. I think really that was the rationale for delaying the move into step 4, is to really understand what the implication of this new variant was on hospital admissions. At this moment in time, Royal Berkshire, they continue to be a lot lower than what they were. And there were 2 patients in hospital with COVID-19 as of this morning, and 1 patient in high dependency unit or ITU. Clearly in other areas that are experiencing higher rates of COVID, their hospital admissions are increasing. And that's something that obviously the government and others will be monitoring over time in terms of whether or not we move to step 4. Next slide, please. In terms of the mortality rates, I think it's worth just mentioning that. Obviously, we know the vaccines are highly effective. We think actually to a degree that actually reduces mortality by 90% is how effective we think these vaccines are. So, and you can start to see that playing out in the data. So if you look to the right-hand side of that graph, you can see that our mortality rate, particularly in June, is nearly statistically significantly lower than what it would have been 4 to 5 years ago, on average, sorry. So that's a good sign, and clearly the vaccines are playing a key role in preventing future deaths. I think obviously we always just do need to mention that we need to consider morbidity alongside deaths and long COVID, and long COVID does equally affect children as well as adults. I think latest data could be anything 6 to 8% of children might have long COVID. So we can't just focus on purely as mortality, and clearly we want to reduce the number of infections as much as we can across all age groups. I think that concludes my presentation, Gordon. Thank you.
Chairman, just to say, I think there was a technical issue which meant that we lost the beginning of this meeting on the YouTube live stream. It said it was streaming and then it seemed to stop and I had to restart it again. So we may have missed the first couple of items.
Thank you, Gordon. I mean, given that they were procedural items, and hopefully by the time Matt started to speak, everyone will have been able to see the stream. Then I think we're fine, because obviously procedural items are no doubt important, but the meat of this meeting is in the presentations. Members, before I come to you to see whether you have any questions of Matt, I just want to, Matt, clearly the data you're presenting shows increases, but also we are aware of vaccinations, and we're aware that certainly the data you put out to members not that long ago showed how efficient the vaccination program was at keeping people out of hospital. So have we got any correlation between those who are getting COVID, and this is over and above the age range correlation that you had in one of your tables, any correlation between vaccination data and the effects of COVID? So for example, if we have older age group getting Delta, is there any indication that those individuals haven't been vaccinated or haven't had both jabs, or any of that? Is there work going on to get that correlation or understand that relationship?
Not necessarily at the local level. I think at the national data, they're obviously they're matching all that data. So they're looking at, who gets COVID, who gets admitted, and then they look at their vaccination record. And that's really informing the overall picture in terms of how effective that vaccine is. I mean, so some of the data coming out of that vaccine is truly remarkable, I must say. I think they're saying that actually the vaccine is 60-70% effective in preventing infection. It reduces transmission by about 50% and hospitalization by 80%. So that's some of the national data coming through. We're not necessarily looking at a local level. You will get instances, and people will hear this, where some people may have had a single dose or 2 doses and get admitted to hospital and can become poorly. And I think, but that won't be as many as what would have been if they hadn't been vaccinated. And I think that's a really important marker to make. And the vaccine isn't 100% effective. We have to recognize that. But as a population, we know it's extremely protective. So in terms of that local correlation, kind of slippage, and we don't have that information to hand, but we can certainly share the most up-to-date data we have at the next meeting.
Thank you for that. Members, I don't see anyone itching to ask Matt any questions, so we shall move on to the next item on the agenda, which is the vaccination programme update. And for that item, as always, we have Joe Reeves, who's locality manager for the Berkshire West group, and over to Joe.
Sorry, just moving between screens. Hopefully you can all see I'm sharing a new slide in the first instance. I just thought it'd be helpful to demonstrate that the government's coronavirus dashboard has been updated to include local authority level vaccination data, and it gives an overall picture. I know members have highlighted concerns that some of the surgeries data has been missing from our usual slide deck. So this provides the overall headlines. Unfortunately, we're still reliant on the data within that slide deck for the more granular data, but I thought it would be helpful to just run through this, which is publicly available. It's on the government's coronavirus dashboard and gets updated at 4 o'clock every day alongside case deaths and admission data. So we've got 107,000 odd vaccinations, people who have had their first dose. I think West Berkshire's adult population, as in over 18s, is around 120,000. So doing extremely well, and 77,000 second doses. So overall, looking really positive. I'll skip this one that demonstrates numbers over time, because I think really it's the overall uptake that this is most useful to display. So we've got 79.9% of our adult population having received a first dose, with 57.6% having received their second. And then down to heat map, which you'll be familiar with this format from Matt's presentation, demonstrates the take up among age groups. So with the 90 pluses at the top, so their most recent uptake percentage being 96.45, and coming down into younger groups. I think already our 30 to 34-year-olds, 68% have received a first dose, which is looking great, to be honest. But I will move on to the usual slide deck, unless anyone wanted a question on the sort of headlines.
No one's leaping at you, so crack on.
Wonderful. So assuming you can still see the screen and my usual slide deck, which, as mentioned earlier, does not cover 3 of the practices within West Berkshire because of the clinical systems used within those practices. So we get about 91% coverage of our population. And because of the timings of when this data is pulled, it's already a little out of date, which is why I wanted to start with the most up-to-date data. So looking really good in terms of our movement from first and second doses when I last reported 2 weeks ago. You'll notice that the rate of increase of first doses is slower than the rate of increase of second doses, and that is because of the policy to bring forward second doses to prioritise getting our most vulnerable fully vaccinated as quick as possible. And in terms of our percentage uptake across the whole population, we're still doing better than our counterparts across Buckinghamshire, Oxfordshire and Berkshire West, and we're comparable to England. This chart breaks down by age cohort, and we've annotated when the vaccination programme was opened up to certain age groups. So looking at the take up in those age groups so far, already our 30 to 39-year-olds, we're just shy of 70% take up. So that's moved on 7% from 2 weeks ago when I last reported. And you'll notice there's been little bits of shift in the older age groups as well. I suppose the point to make is if you are over 40, over 50, over 60, over 70, and you've not yet had a vaccination, the vaccination programme is still available to you. So you've not missed your chance. So if for whatever reason you were unable to receive a vaccination when you were first being called and would now like to, you can access a jab via the National Booking Service. This slide breaks down via age and ethnicity. And overall, over the last 2 weeks, we've seen vaccination rates among ethnic groups with lower take-up increasing quite well. So increased by 12% overall for Bangladeshi people, 11 for Indian and 10 for white and mixed Black African groups. In comparison, white British increased by 4 percentage points. I've mentioned before our general wisdom that the white British population come forward very quickly when they become eligible to receive a vaccine, and ethnically diverse communities catch up a little bit later, which I think those percentage rate increases just demonstrate. And the other point on this slide is about a mobile vaccination bus, which at the moment is being concentrated within Reading and Wokingham to complement the surge testing. So there's that emphasis on vaccination as well to protect those communities. And no current plans to do anything similar on a surge basis, but there are plans for a pop-up clinic in Lambourne targeted at the racing community, where for convenience reasons or whatever other reasons, they might have found it really difficult to get out of work to go and get their jab. So we're going to take the jab to them, and hoping to get some good take up, and we'll work with the local community and racing welfare to promote that clinic. Further by ethnicity, this slide demonstrates the rate of take up among our most populous ethnic groups, and just showing the curve there of the Asian Indian group increasing more rapidly, whereas the white level of take up has sort of remained fairly, has increased fairly steadily. And then again, that compares here with the same population in Reading and Wokingham. So Wokingham have always done pretty well, and we've just taken over Reading in terms of take up from our Indian population. So in terms of our high risk groups, you'll see we've only got very small numbers left who are yet to receive their second dose. So there will be a big push to make sure that these patients get their second dose as soon as possible, so that we can get rid of any pink in the left-hand columns for each section. And as you speculated at the last meeting, Councillor Bridgman, there has been a good level of catch-up in the populations within the Thatcham Central and Greenham ward. Greenham is still looking slightly lower than Thatcham, but it's not hugely different from the overall situation across West Berkshire. So I think the key point here is to keep making sure that the vaccine is available at convenient locations, and people know how to book it. And we keep promoting messages about how easy it is not only to book, but also to then go in and receive the vaccination, particularly now the two pharmacy sites at Kennet Centre and Boots on Northbrook Street and Newbury Centre are really convenient locations, and can pop in while you're doing your shopping. So there's super accessible now. And that brings me to the end of those slides.
Thank you. And I hope that if anyone watching is still in any doubt, sorry, I was getting feedback from somewhere. Casa Macro, if you could just mute for a moment, just in case it's there. See if that's, yeah, that seems to change it. Yeah, I was going to say that if anyone is in any doubt that having a vaccination keeps you out of hospital for the most part, and obviously there will still always be exceptions to that particular rule, hopefully those charts coupled with what Matt was saying earlier get the message across. Councillor Doherty.
Thanks for the presentation, Joe. Just for a point of clarification, there's a mobile bus unit that's giving vaccines out. Was I right in hearing you're saying that it's not currently operating in West Berkshire?
Correct. Okay,
because I mean, I understood the part and parcel of that mobile bus unit was to go to those wards that weren't as accessible. So just that's an interesting point of clarification that I think we may need to take up.
So plans are underway to site the bus in locations in West Berkshire, but over the last couple of weeks it's been focused in Reading and Wokingham to complement the surge testing. So we will see it within our district next week.
Next week. So there's actually plans for it to be here next week.
Yes.
And will we know where? So how will we be able to let people know and promote that?
Yeah. So the communications is being worked up currently. It's going to be targeted particularly at the racing industry within Lambourne. So we're making sure it gets promoted directly to that community as far as possible.
Okay, thank you.
And Councillor Macro.
Thank you, Mr. Chairman. Yes, I was a bit put out last week to see a broadcast on the BBC, and it was also on the radio and on Newbury Today, that the big publicity that the racecourse was closing down, but no mention at all of the replacement facilities, which I think might confuse people. So I did email Matt about this, but I'm hoping that we can get some communications out to kind of convince people that there are still facilities there and to go to them. There's also road signs up pointing to the old one as well still, or there was on Friday.
Thank you. We'll pick some of that up with Matt when we come to comms. Anyone else? No. Okay, so we move on to public protection. And Sean Murphy, who is our manager, and so update us on what's happening.
Thank you, Chairman. I've not got a formal presentation tonight, as I updated the board at the last meeting, but just to give you an update since then, as Matt has already alluded to, obviously with the rise in the number of the rise in the infection rate locally, clearly that's involved us in more work around outbreaks. But as Matt has already said as well, that they're primarily in settings with young people, so schools and the like, although not exclusively. But we continue to monitor those on a 7-day basis and work with colleagues from other services across the authority to look into those. With that, obviously, basically with the rise in infection rates, we're also seeing a rise in the number of cases coming forward for local tracing. And obviously we're picking those up again on a 7-day basis. One of the main changes that's been agreed in the last week or two is that we're merging the work that we do around local tracing with the work of what was the hub. And this will enable us to bring together the work that has been done on isolation calls with the tracing work. So that's in hand at the moment, and will take place in the next week or so. Just moving on to the issue of compliance, clearly with the announcement on the 14th that we were to stay in step 3, we've extended the work that we are carrying out in relation to compliance work. So these are the visits to businesses, which are primarily not just around checking for compliance, but also the provision of advice and support for those businesses. So we have extended those through until the new planned date in July. That step 3 has been extended to. We're keeping it under review. Clearly, we'll have a better idea a week before that as to what, if any, provisions will remain in place. And at that point, we'll be able to review what it is that we'll be doing going forward in terms of working with those businesses around any changes and carrying out any checks that we will continue to carry out if they're needed. Just moving on briefly through to the issue of events. Clearly, obviously, the delay in step 4 has had an effect for some operators. So we have seen some operations that were due to go into step 4. For example, at the racecourse, have had to stay for at least one meeting in step 3 with the limitations on numbers. And unfortunately, we've also seen 1 or 2 events which have been postponed into 2022, just really linked to the kind of uncertainty, I suppose, really about where the next stages are going, and the fact that basically they may only have a few days after the announcement on the next stage, basically to make a decision. So amongst those basically are the events that were due to take place at Englefield on the 22nd to the 24th of July, the music events. But we continue to keep an eye on all of this. We are working with event organisers to keep these things under review. We're working on the basis that some degree of risk assessment will always be needed anyway, from the point of view of health and safety and protection of the public. And as and when we get new guidance or new legislation, we'll work with these organisers and the businesses really to update their policies and procedures. So that's my update, Chairman. Thank you.
Thank you, Sean. Members, any questions for Sean? No. Okay, so we move on to comms, communications, and Martin. Martin.
Good evening, everyone. I just have a handful of slides to show you, just to update you on where we are with things. Hopefully you can all see that. So really, since we met a couple of weeks ago, our communications have focused on three key areas. The first one was the announcement last Monday, and widely trailed before that, that the move to Step 4 was going to be paused pending the tests that were set up before not being met. So we did some communications after that. It was widely known about in any case, but we did some comms shortly after the Prime Minister made his announcement, just to remind people that the move to Step 4 had been paused and that there were restrictions remaining in place. So you'll see here we sent out one of our COVID e-bulletins out to our 40,000 subscribers. We included it in our media briefing as well, and some other communications, just to remind residents what restrictions remained in place and how they could continue to keep themselves and others safe over the coming weeks. And we'll keep that under review as we look ahead into July and what might happen later on in the month. The second focus is one that I've spoken about at previous meetings around community testing and our community key collect service. So that's up and running now. That seems to be running well, but every so often there will be some tweaks to services or changes. So we have been making sure that our communities are up to date with the latest with regards to how they can get tested and access home testing kits, and of course to remind them that if they do test positive at home, to go for the confirmatory PCR test, which will assist with the sequencing of the various different strains as well. And the third area we've begun to look at as the eligibility for vaccinations has come down, and increasingly approaching young adults, and from last week from 18-year-olds and upwards, it's just looking at what we can do in terms of communications just to encourage younger adults to have their vaccinations and to encourage others to do so as well. We really wanted to listen to what younger people were telling us about why it was important for them to get vaccinations as well, and to put our residents front and centre in some of that communication. So we started a programme of activity really around what's your reason, asking young people what their own personal reason is for getting vaccinations. And we started rolling those out, starting on Instagram actually over the past few days. You can see one of them on the right there. I appreciate it may be a little small, so I was just going to take you through some of those. If I can, you'll see we've got a range of colours and younger people there. We've got some more we're going to be rolling out. So the first one, and we're grateful, I should say, to all of those that have taken the time to work with us on developing some of this. So Elizabeth talking about getting vaccinations because she wants to go travelling again. Lizzie is one example, who is looking forward to just being able to spend time with friends and family, sort of safe in the knowledge that that she's done what she can to protect herself and others through vaccinations. Hannah again wants to meet up with friends and family safely, and then we have Chinora at the end, who again is looking forward to going out to see some live music once everything resumes. So those are the first three we're going to be launching. We've got others too. Very keen to make sure that those case studies we're sharing are as representative of our communities as possible. But I think it's important that as well as us encouraging people to go and have the vaccine, actually we listen to those that are in those age groups also. So you'll see more of that coming over the next few days. So that concludes the slides that I've got on the activities that we've been working on over the past couple of weeks. But I'm more than happy to take questions on any of that, or indeed anything else I haven't covered.
And no one is leaping to ask you a question. So I think you've, in the words of Councillor Pascoe, got off lightly.
Thank you.
So, members, that effectively concludes the main business of the meeting. The last item, well, an ultimate item on the agenda, question of future meetings. Members, mentally, I have been tying the sequence of meetings to government announcements about steps 3 and 4. And I think that we do a service in public where the council and the district is in relation to such things as the epidemiology and the take-up of vaccinations, and pushing the message about vaccination, avoiding hospitalisation, as I hope we've got across. So in my personal view, I would like to continue until I would suggest one meeting after we are back out of restriction, so we can see what, if any, the effect of that is, even if it is in a couple of weeks of that exit from restriction. But I'm very happy to hear what other members think about our meetings. Matt, you had your hand up and then you put it down again, Matt, and then you've...
No, I'm happy to talk. I wasn't sure if it was in relation to your question. I'm happy to go with what you suggested. I was actually going to propose an agenda item because I know my colleague Sarah Rayfield's been working hard on vaccine hesitancy and inequalities, and I was just wondering, given how important that is, whether that might be an agenda item for next time. But happy to go with your proposal.
No, I certainly think that's a very good idea, because certainly the whole issue of vaccine take-up and vaccine hesitancy, and what I perceive to be the case, now I haven't got any direct evidence, but it's to some extent apocryphal, that those individuals who are currently being hospitalised may not have had both jabs and may not even have had one jab. That's based on age group and knowledge about individual, what I've been told about patients. So that whole message about the link between vaccination and avoiding hospitalisation, I think, is very important. So I'd like to certainly look at vaccination hesitancy, and certainly some of the work that Sarah's been doing. So I think that's a great idea. Councillor Stewart.
Just to say that I totally agree with your reasoning. I think we should continue until we feel comfortable that we're in a situation where we don't need to be relaying this information or giving the opportunity to the wider public to hear these conversations. So I'm very happy to continue with them until we all agree that it's right to stop them.
Okay, so members, I am going to put another couple of meetings in the diary, Gordon, fortnightly meetings, and I hope you will join with me in thinking that's a reasonable idea. I see no one violently shaking their head. We have one suggested agenda item from Matt. We obviously have the standard, but I'm, again, very happy, and I suggest that to email me and to email Gordon about anything you think has cropped up, if it crops up outside meeting, you think is something that would be usefully discussed or presented. And if that is it, I'll now look to see if anyone has anything else they want to put in the meeting. I see nobody. So I'm going to close the meeting, ask members